I'll read the scenario, and then I want you, if you want to participate, here you go. You could put the answer choices in this beautiful chat box here. Again, you're welcome, doctor, everyone here. Let's see. I'm going to answer Carolina's question after we do these questions, okay? So I'll read the scenario, and I want you guys to think of what the answer choices could be. I want you guys to also put in the chat what you want to eliminate, yeah? Okay, I'm going to open this up a little more. Let's check this out. I always, just so you know, when you stress out, you make mistakes. Make mistakes, you might fail. So why don't I stress out? I never change my routine. Whether the question is 3 lines or 20 lines, I always attack the same way every question. The minute I personally start changing my routine, I get nervous because I'm not used to it. So this is test taking 101. Never change. I had one student, which pissed me off. She took her exam. I told it to her face. I'm not hiding anything. She literally, on her exam, on step 2, the first 5 to 10 questions, she started panicking. So instead of continuing, she went to the bottom, going upwards. So she changed her routine last second. That's no problem. Have you ever done that before, I asked? She goes, no. So on exam day, you decide to change a whole different routine, yet for so many months, you've been practicing the same routine. And guess what? This individual was not able to finish every block in time. Why? Because instead of staying confident and having confidence in her routine, which gave her success on all her assessment tests, on exam day, because the first couple of questions she wasn't clicking, she wasn't hitting them, she was worried about time, she changed last minute, called an audible. If anybody has a football plan, audible football player, football fan, audible is like, hey, we had this plan, and last second, we're changing it to fool to play with the other team, so they don't know what we're doing. This individual had a tough time on the exam. I share with you examples, not because I'm putting anybody on the spot. You don't know this person, but I'm putting examples in front of you because I know what's real and what's not. If you want to pass the test, you have to be a machine. You have to be consistent with what you do. So I always read the last 2 lines. Ready? Boom. Watch this. Physician prescribes a drug that blocks peptide transfer binding, blah, 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 50S. Okay. 50S tells me one thing. Buy at 30, sell at 50. Buy at 30, sell at 50. It is a mnemonic you all need to know. Buy at 30, sell at 50. Watch, ready? Watch this. Buy at 30, sell at 50. So it's a mnemonic here. Mnemonic, boom. Buy at 30, sell at 50. I'm going to move it right away because I want to play the game to show you, right? Okay. Which of the following drugs was prescribed? So if you don't know the mnemonic buy at 30, sell at 50, it's going to be more difficult for you. You'll spend longer time. Okay, so 50S. 50S, we know that the buy at 30 is aminoglycosides, tetracyclines. Okay, so aminoglycosides, tetracyclines, take out tetra. Doxycycline, take this out because doxycycline is tetra, right? Metro, we know Metro doesn't deal with a 30 or 50. Take that out. Levofloxacin is what? Is a fluoroquinolone, yeah. And something about inhibits DNA gyrase, yeah. Topoisomerase, yeah. So that's out, cool. And then we have Clinda, Azithro, Ceftrax, or Penicillin. All right, so we take out this guy because we know that by a 30, sell at 50. At 30 is amino and tetra. The 50s are chloramphenicol, clindamycin, erythromycin, linezolid. Now, the erythromycin is not just erythro, it is the macrolides. You want to learn them fast? A for azithro, C for clarithro, E for erythro. Okay, ladies and gentlemen. So look at this.